Welcome to the Jeremy Mullins podcast, where we take a deep dive into different education topics to help you optimize your life. I am your host, Jeremy, and today I'm I'm here with special guest, DPT, which is a doctor in physical therapy, Miranda Henry. How are you today?
I am great. School is almost over, so that's going to be summertime after one more week. So
All right,
sports are almost done. Summer's coming. It's going to be good.
we are there. Our summer's going to like fly by. It's already like basically planning out till the kids start, and I'll get into that like maybe a little bit later. It is crazy what the summers are going to look like. So,
It is.
before I let Miranda give a little bit of her background, I just want to say she is first and foremost how we met was she's actually in my Team Alpha online, and I don't talk about it a lot of times. A lot of times I say it's just my coaching platform, right? I do all my wellness coaching on the First Form platform, and we do everything from group calls a week to announcements, checking in daily, all that. But the ultimate goal that I try to do with that group is to develop a subculture online of good people, right? And that's what's neat about this is you and I talked about you coming on the podcast. Actually, probably when I first launched it, we discussed it about having you on here, and it's just been a super busy. But also, this last injury kind of put me in the PT world where I'm like, okay, I need to have you on, kind of talk about, some PT things and just have a great conversation. But it's kind of wanted to mention that from like our Team Alpha being this cool little subculture that is in an online format. And that's the way that I look at it. Yes, we started out quote unquote client, coach, but now it's more to what I think of more of like a colleague, as far as us bouncing things off each other, but also accountability standpoint when you're
For
in.
sure.
Yeah. So, all right, real quick, guys. Once again, thanks to our sponsors of the podcast, Summit Rejuvenation, which on IG, it is just that at Summit Rejuvenation. Remember, guys, if you've not had your blood work done, I highly encourage you to get your blood work done, at least once in your 20s, once in your 30s. And then, of course, if you have your blood work done and see that you need to have any, hormone replacement done, go for that. Another thing I think I want to mention for them that's a benefit, just with me having my past injury, I was actually able to play around with some peptides that I had never seen before. And what's neat about it is it was actually a prescription on peptides versus what I'm finding in this world of peptides. They're for research purposes, a lot of them that are available without a prescription. So another rabbit hole we can go down later, but and then also GreenUp Wealth, which is our financial advisors for myself and Reno. If you need to speak to them on anything financially, reach out to them. Both those individual groups I just mentioned do free consults for any of the listeners of the podcast. So that is out of the way. Miranda, give us a little bit of background of you, history of, school, what you do, and then just kind of how you stumbled on the First Form app where you and I got hooked up in that sense.
Gotcha. I mean, I'll try to keep it brief, but like I was a high school athlete in a super small town. I train wrecked my ankle, and like most teenage athletes, I didn't tell my mom because we were in a tournament and I wanted to keep playing. So I taped it and kept playing, and then it was bad. But then I earned myself a ticket to physical therapy, and I was like, this can be a job. This is fantastic. So that was a great and very boring because most physical therapists found physical therapy by an injury. Um, I worked hard in college. I met my husband undergrad at the University of Northern Iowa, and then I went to graduate school for physical therapy at the University of Iowa. I found the program just invaluable, great program to this date. But unfortunately, like every program, they can only teach you so much in 3 years. And so since that time, I'm always craving more information. I think I've said to you many times, like anxiety is my superpower. I like to have more knowledge. I want to know more because I want to help people get better. And not only do I want to help people get better, I feel like I've found this perfect niche where I get to be competitive with it. I want people to get better, but I want to get them better as quickly as humanly possible.
Yes.
And the more information that I have, I feel like the better I can come at that. So, I mean, I'm a board certified orthopedic specialist. I'm certified in dry needling. If you've heard of that, it's where you use needles to kind of stimulate and promote healing through trigger points. I'm a certified MDT, which is a mechanical diagnostic therapy. I think that would be fantastic for new grads if they're having trouble with just streamlining diagnostics. It's a great one to have. And then I just recently became certified vestibular and concussion therapist because I see a lot of teen athletes, a lot of lacrosse players, a lot of soccer players, a lot of football players. And it's, again, if I'm working with that population, I feel more comfortable having all of the information to help them.
Love it.
Um, my husband and I moved to Georgia from Iowa in 2005. We've got three awesome kids, 13 and 10-year-old boys, and a 7-year-old daughter, and a dog that's crazy and sleeping right over there. I moved here. I worked for an amazing hospital. I worked inpatient. I did wound care, oncology, and weekend coverage. So I got to see everything solo because I was at that time the only PT on the weekend. They were a tiny hospital. They're now huge. Uh, but I wanted to always be in orthopedics, but I started with that inpatient route because you can't know how to fix something post-op if you don't know what went into it pre-op or immediately after. And I got to know the orthopedic surgeons on the weekend because they're on call and their schedule is a little bit later. So they're more likely to answer questions and shoot the breeze. And so I had a lot of amazing mentors early on in that way. But I did ultimately transition to the hospital outpatient. And it was amazing. And the team that's there is still amazing. But the limitation is it's hospital based. So hospitals tend to have a little bit more red tape, a little less autonomy. And the schedule of outpatient is not always favorable to family life. It's a little bit more rigid in that way. And that's not obviously just where I work, that's every outpatient. And so in 2015, Georgia joined a lot of other states and we had what's called direct access, meaning you can go see a physical therapist without having senior primary care who refers you to orthopedics, then to PT. And if you don't know, if you're not seen pretty quickly after an ankle sprain, you've lost a big window of time. Or you can really have amazing early results pain relief wise if you have a herniated disc, if you get treated quickly. And a couple of coworkers and I grabbed a drink after work and I'm like, well, what if we present to the hospital? We do this direct access and they're like, no. And, but we
Yeah.
were respectfully, was like, okay, well, we tried. And ultimately, my current business partner and I just sat down and we're like, well, what would this look like? Like, we love where we work, but it doesn't have some of the family life and flexibility we need. So we started precision physical therapy in 2015. And at that time, there was no other direct access PTs that we knew of anyway, in our area. And so it was a little bit scary and it was a lot of educating the public on, no, you do have a choice. Again, I'm trying really hard to be politically correct, but like if you go to see an orthopedic at their office, of course they're going to have a physical therapy office there. Now, they're going to hire wonderful people. I've never met a physical therapist that didn't care about their clients, right? Like, so it's certainly not me speaking ill of these clinics, but a lot of them are productivity driven and time driven. And, at that time where I worked, they were not doing that. Like the manager or supervisor there that is still there, he just guards that quality time with your patient fiercely. And I loved him so much for that. But I felt I needed to leave because I couldn't be at a clinic until 7 o'clock at night and be present at my home. But with our clinic, we see people one-on-one. We set our own hours. In the beginning, we were mobile. We've kind of steered away from that as we've gotten busier and busier. And it's a pretty small town. But all of that has just led me to learn a lot more about business. We're building the plane as we're flying it. And also just to step outside of my comfort zone, which I'm not always good to do, which is why I'm probably a little nervous sounding here. But I just love education, and that also affords me the time and platform to do that. So we have done a lot of workshops with gyms. I've done it on mobility, which we're talking about today. I have some amazing clinicians I work with female athletes and, perimenopausal health, because it's a different animal, right? Like when you have different hormone shifts, your body responds differently to all things. We've done running clinics. We work heavily we have an amazing running club in town. We're the second largest in Georgia, only to Atlanta. We have an amazing triathlete community here in Peachtree City, which is where I'm located. It's just a great active town. And, being brave enough to start our business when there wasn't a lot, like, I think it really afforded us some trust in the community, and we've just slowly built it. And I know that was a very long-winded way of saying it, but I
Oh, I like it. Listen, I think for the listeners to set you up and guys, Miranda volunteered her time when, I put out to my group online that I was going to start a podcast up. We were discussing bringing her on for what you just mentioned, right? Like, and I think this is something that you and I have in common. One, happy early birthday, because that's coming up
thanks.
tomorrow. We are almost on our same path in life. And what I mean by that, when we talk about career, we're both about the same age. We're within a year of each other. So that is something that we have in common, but it comes down to a couple of things that I just wanted to pull out of what you talked about. I think connections in life are very important, right? And you just mentioned that, like, nothing against PTs in the hospital setting, that's coming with the clinic. I chose not to do the clinic that did my surgeries PT. I chose to do a personal connection that I had because I feel like he's more like you, right? He's more, that one-on-one, it's his clinic, that type of stuff, right? So that was one thing that, you and I talked about was like, hey, are you going to do that route, or, what are you going to do for PT? So I think connections in life matter, right? And then
Absolutely.
sharing your wisdom, and hopefully this is not the only time that I have you on. See, I'm going to put you on the spot now that we're recording. Have you on in the future
I'm always down for education, always.
yeah, to give a little bit of that education out there. But the other thing, I guess there's two more points I want to make, and this is the saying that we have for our team online, like, people first and winning matters, right? And you have that mindset too of like, okay, yes, like, Jeremy, I want you to get better, but I want you to get better quicker and faster than what the papers say, or how fast can we do this in a safe manner. And I think that's the way I've always thought about it too. Like, how do we make people win and be efficient at life, right? And sometimes life is retirement. Sometimes life is dropping body fat. Sometimes life is recovering from injury, right? Whatever we're doing, let's be competitive at it, right? Let's win at it. And then the last one is education is a core value. I love that, right? And you were talking earlier, you're like me, I've got it somewhere here, in an envelope of like all the certifications that I've done, right? And it's
Right.
tons. Some of them I don't use. Like, I have a running certification. I can't tell you the last time that I taught, pose running to an actual client, right? But we've got those certifications there. Both of us love, education and just, more knowledge and how to, apply that to our clients. Okay. Now, this is not, and guys, you'll have to bear with us before we get to actually what I brought around here to educate about, because I think this is going to be a good storytelling. But let's think back to, because you mentioned this earlier, you can only learn so much in school, right? So
Hmm.
let's both share one or two things that maybe we learned in school, we thought was the right approach, that we did in, the 23, 24, 25 year old professional that we were, versus now 20 years of experience, right?
Right.
So what would be something that comes to mind that you think,
Ooh.
like, didn't hurt the client, right? But it just wasn't optimal what you were doing.
I think probably the biggest mistake, and maybe this falls into that, maybe it doesn't, is I feel like I went into practice that I was going to fix them, right? Like, I'm going to come in and be like this knowledgeable, like, I just spent so much money and so much time and invested everything to learning all of these beautiful tools. I'm going to come in and use them all, and I'm going to fix this person. And I just think that that is, a mistake that I learned well from over and over, right? I mean, you can't fix someone. You can educate them. You can educate them, and you can do the assessment, and you can find maybe the things that can be corrected, but I can't make them do the exercise. I can't make them drink the water. I can't make them address all of the other health metrics that absolutely influence their success in physical therapy, right? And that rigidity, like, certainly devolved over time, where, again, I just had just amazing teams around me. They're like, well, it's not my fault. I had just one gentleman, like, how some people can get away with saying things, and then if you said the same thing, you'd be like just ostracized. I had this guy that I worked with. He's just a lovely human, but he'd be like, it's not my fault they didn't do it. Or he'd be like, or if he had a difficult patient, he just was just amazing at disarming them and diffusing a situation. But I think when he was like, well, I can't make him do this, I was like, you're right, we can't. I don't know. He just said it in just a way that it hit and stuck. And I think from that day forward, I have structured my entire evaluation differently as a result. I don't, unless the assessment piece requires it, right? You can't test somebody's ACL, MCL, LCL without laying hands. But aside from the assessment, I do nothing treatment wise, hands on, unless they're just incapacitated first, right? If someone is in terrible back pain, of course I'm going to help them. But if they're coming in for knee pain, I do the assessment. I have them do potential correctives, and any relief they can then get before I've even laid a hand on them, I will point it out. Like we're like 40 minutes in, I'm like, you just told me that your pain is 50% better. I want you to just take a moment and realize that I haven't laid a hand on you. And so at least 50% of your pain reduction is now in your hands. And so I think that transition from taking and assuming that responsibility to putting it on my patients has done nothing but help me and my anxieties, and also them to just really take that to heart, that they have more control than they might have been led to believe previously.
And I mean, I'm going to agree to that from wellness coaching too, right? Because, I've learned this before, and I've said this over, and over, I think on the podcast, like if I have 100 people come to work with me, 30 of them are not ready to make a change. So I've learned, okay, I can still educate, I can still provide this information, but I understand that 30% of them are not ready to make a change. And I cannot let that eat at me and cause me to be negative towards the other 60%, right? So I think that's a very good point. And for me, I think that probably the biggest mistake that I would have made early on was like the law of thermodynamics, right? Energy cannot be created or destroyed. It's calories in versus calories out, because that's what we were taught in school. Where, later on, 20 years down the road, I'm learning it's not. Protein is such a big thing inside of diets. Like I can increase, protein up to 200 grams in females, and they're on 2,000 calorie diets and they lose weight where they weren't losing weight on a 1,400 calorie diet because they weren't eating enough protein. So I think that's the biggest thing, like that I'll look at over 20 years back to what I was teaching then versus teaching now. That's different, right? And it is. I hope for both of us that we're better, practitioners, we're better coaches, and we're better parents at 50, 2 and 53 respectively than we are now, right? Another decade of experience will do that, so I think that's important for, the listeners in general, no matter what you are doing in your life or where you're at in your wellness journey. Like, remember, we should always be learning and know that you're going to get better over time.
And I just want to add a very close second for me would be a willingness to ask for help. I don't know if it was just my family or the Midwest or being a female in a pretty male dominant field, but man, just asking for help. Nobody ever says no.
No.
Right. And then if they do, that speaks more volume about their character than your willingness to be vulnerable and ask for help. And I think once I came and like asked for help and I started asking questions, mentors just come out of the woodwork. And I think younger clinicians or anybody in general can certainly benefit from that.
I had a question the other day, and I've been trying to attack this in a politically correct position, like you said, and someone was like, well, Jeremy, how come, you keep producing results, but you also are coach to coach and you're teaching all your systems? And I try to tell them, guys, it's not about the system. Systems are important. Don't get me wrong. Systems are truly important inside of anything, right? Checklists or whatever those systems look like, but you can't beat the personal connection, right?
Nope.
And experience, what we're talking about with this is experience goes into that, right? And I'll say this, and a little bit of a soapbox, but we live in this world now, especially in the wellness coaching, that like people are doing online coaching that have never coached people in person. And I think that's to a degree, not necessarily, I don't want to say dangerous, right? Because they could have the knowledge, but they just don't have the experience because you haven't worked with people. I mean, think about it in the world of PT, right? If you could have a PT that like, okay, I'm only do PT evaluations and educations online, and they've never worked with people in person, right? They're just going with their degree or their certificate that they have. Totally get it. You got to have more than a certificate for PT. This is more towards the wellness coaching aspect. But just think about that. So I think that's something that I continue to want to, and the reason I'm saying this, educate my listeners, but get people to realize that, like, that's the difference, when you're working with people who have the experience that comes in those facets.
Sure. Yeah. No, I mean, I think you're absolutely right. Like, I mean, there's so many ways that you can say that, in healthcare, you're kind of taught bedside manner because if you're in healthcare, you know that different types and specialties have different personalities, right? Like they just do. I guess I don't want to like call myself out, but like you also, if you need somebody that's doing something super highly technical, you don't necessarily need a good personality, right? Like, I don't care if my surgeon has a great personality if he is technically amazing at fixing something, right? But then in a rehab professional, you're spending, 1, 2, 3 days a week or every other week or however your structure for their plan of care is. You're spending so much time. If they don't buy in and believe you and trust you, they're not going to do it. Or if you overload them with too much information, they're not going to do it. People are all busy. I've never met anybody that wasn't busy, right? They're busy with their own thing. So, I guess another mistake I made early on was giving people like 10 things to do. They're not going to do it,
Yes, yeah.
right? They're not going to do it. You give
One,
them 1 or 2 things that are going to correct their biggest issue first. And once they buy in, then they're certainly willing to add in more.
I love that. And that kind of goes back to what you're talking about, like your toolbox. We want to throw everything that we know, right? And that's kind of the ego thing too. And there's nothing wrong with that, but it's like, when you're young and you're just getting out of your profession, you want to prove to people that you understand what you're doing. You want to prove to them that you have the knowledge, right? So, and we, neither one of us, we talked about this a little bit offline, guys. We're not throwing stones. We are basically throwing stones at ourselves. These are the things that we've learned, right? But I think
Right.
that really can get us into the education today. Where and once again, my intent, with having you on today is just, very broad. And I always like to say this when I start giving out nutrition advice. We are not treating any injuries. We are not giving any, quote, practical or exact programs to do. We are just here for education purposes. Okay. So if you do have an injury, please, seek out your physical therapist
Yes,
or, PT. Because I get a lot of those questions online. Someone's like,
for sure.
Jeremy, this is hurting. What exercise can I do? And I'm like, I'm not going to touch that with a 10-foot pole, right? Like,
Right.
I need you to have that checked out and then follow a program, right? But let's just speak in general of mobility, right? So talk
Okay.
about your favorite probably exercises or movements for lower body mobility and then some for upper body.
Well, and I don't have it with me, but I did share with you a document that I give to all my clients that ask. I don't try to force it on them, but that's a difficult question to answer because what I advise, once we've kind of addressed, like somebody comes in for a knee, right? Knee pain. Once we've addressed that, almost always it starts to go into, well, now my shoulder, like my knee's better, but I'm here. Can we talk about my shoulder? Of course. In my situation, I can do that. I really advocate, like, you go to the dentist twice a year, right? You go to the ophthalmologist yearly. In theory, we should all go to our medical primary care doctor every year. But the way that our system is structured, unless you actively tell them something is wrong, they're just going to do a quick screen, do some maybe basic blood work, which is why I'm grateful that your sponsor is doing what they're doing because we're fortunate in this area to have a couple people doing that exact thing. Like anything, if you don't know where you are, you don't know where you're going. And the sheet I shared with you is I advocate every month. If you're over 40, you could probably get away with less often when you're younger and not injured, but you should take 15 minutes once a month and go head to toe, right? Look all the way up. Take stock. Is something pinching left or right or center? It shouldn't be, right? If you're looking down, does it give you a little bit of an upper neck headache? It shouldn't, right? Can you turn your head all the way to the right, all the way to the left, side bend, side bend? And a lot of people don't appreciate that's not all your neck does. It also protracts where we all live on our phones and it retracts. Okay. And if you lose range of motion, you're not going to notice it right away. Right. I think it was Atomic Habits. I read it several years ago. My husband got it at a conference, but in the PT world, there's active range of motion, passive range of motion, and then some extras in between, resisted, assisted. But if you take your wrist as an example, that's as far as I can go actively. Okay. I can't force it any further on my own power. But then if I passively go, I go another 20 degrees. That 20 degrees is my buffer if I fall. Look
Impressive.
at you.
That's pretty impressive. I need to work on that. I'm sure
That not too long.
I'm sure this lack of, being able not be able to turn it all the way might have had something to do with this during
Maybe, but like we can't play that woulda shoulda.
the
But my point being is the difference between your active range of motion and your passive range of motion, that's your buffer system, right? And the atomic habits plays into this. And I think I've heard you use this before. Ice is ice at 0 degrees and 10 degrees and 20 degrees and 30 degrees. But at 33 degrees, you have a symptom and now it's water.
Yeah.
Things change long before we have a symptom, right?
No different if we're speaking, pre-diabetes, insulin resistance, pre-diabetes, diabetes, right? It's
Exactly.
not just got diagnosed, or you just got diagnosed, but we could have prevented that ahead of time. And what you're saying here is so important. And I'll put that document. I'll either get it from you or pull it back up. I know you send over, so we can put it as like a download
Perfect.
for people. But we were at the H2F conference for the military last month, I think, and Dr. Kelly Starrett was there doing the PT mobility lecture, and he asked everybody just to basically raise their hands, right? Of course, I've got some, you can't see it probably on film, but there's a difference right now in how far this left arm is forward compared to the right one. Right one's probably straight up and down. If you looked at it from the side, my left one's going to be forward. I was amazed that when he asked people to hold their arms up, how many people
Don't do it.
they were angled forward, right? And it was just like, oh my goodness, right? Because as a coach, I can see that, right? Because if we're going overhead with movements, pressing, snatches, fill in the blank, like, okay, we want it to be straight overhead, not out in front. And it was amazing to see how many people just lack that mobility in just putting hands over top of their head.
And I mean, that's not uncommon. And you could look at any other joint and do the same thing, right? And I mean, how many people do you know that have sprained their ankle in their lifetime? A lot, right? And you'll see them at the gym. They're the ones with plates under their heels. Like they can't get into that full dorsiflexion. So then it limits their squat range of motion. Or they've lost internal rotation at their hip. And then that is going to limit squat or lunge formation, right? And that's why I just think that there's value. And if you do share that document, how I use it, and for the listeners, it's just super basic and super general. Like I have more specific ones for my different athletes, but my suggestion on this general form is just, all right, neck, up, down, left, right, turn, protract, retract. Did anything feel weird or asymmetrical? Put a star by it, come back to it. And then you move on to your shoulder, just like Jeremy, raise your arm up, raise your arm back, side. Can you reach up the back? Can you reach down your back? If you don't have great range of motion, if one side feels significantly stiffer than the other, a little bit of stiffness in your non-dominant arm is normal. But if there's any discomfort, certainly put a star, right? But you can't address a deficit that you don't know exists. And once you kind of go head to toe, maybe you only have 2 things starred. Awesome. Then you don't have a lot of maintenance work to do, right? But if you find yourself starring a lot of things, well, that should tell you like, okay, I have a lot of things starred in my neck and my shoulder. Do I have tension headaches? When I lift overhead, does it give me trouble in my bicep tendon? Like when I sit at work, does it hurt in the front of my hip when I stand up? Right? All of those things can be attributed to a mobility loss. And we just ignore it like, oh, I'm 40 now. It takes me a minute to get up from it. No, it shouldn't take you a minute to get up from the chair.
Yeah.
It should not hurt. Right? If you have had an orthopedic injury, certainly there are different considerations. But if you have not had an injury, you shouldn't feel that way when you get up.
Now, I have a question there, and I'm going to go back to it, right?
Sure.
I wrote this down, systematically, right? Because you could have an injury or something bothering you. So, like, hey, Miranda, my hips bother me, right? Well, it's not actually my hip, right? Like, that's where the pain is, but maybe it's because of something else. And I wrote stubborn down below it because that's the way most of us are. Like, oh, it's just a little injury, right? Or, if you have an injury in training, it's like, well, your body will compensate for it. Okay. But before we get to that, because you mentioned earlier with you being direct access, I just want to make sure that I am clear on the way that I'm interpreting this. So that means that someone can come to you and they can see you directly without a referral,
Mhm.
right? And then depending on what the insurance covers as far as physical therapy, then you would go into that program, correct?
So yes, so like like all healthcare in the states and like all insurance in the states, and a PT's favorite phrase is it depends.
100%.
because because not all 50 states have direct access, so it depends on your state. Not all states allow for dry needling, right? Florida, you're in Florida now. I think they just recently got it, right? California still doesn't have it, right? So every state is different when it comes to what a physical therapist is allowed to do, for one. And the states that do have direct access doesn't necessarily mean that insurance will cover it. Some insurances do require a pre-authorization or something. So they make it a little bit confusing. I know we try to stay politically correct, but on the point of insurance advocating for clients, I can't be politically correct on that, because
Yeah. And
anybody that is non-medical that is telling you who you should see or how you should be treated after an injury, I mean, it's great. Like, it's great for a financial background, and it does help mitigate some medical fraud, right? Like, that's been shown, certainly, and people love to abuse the system. But with direct access, you can have a direct access that accepts insurance, and they'll just be like any other private practice. My practice decided to be a cash practice. So we bill upon service. Now we'll provide super bills so they can self submit, but then that will almost always go towards a deductible.
okay. No, and I
So
think
it gets confusing, but it's one of those things that nobody else is going to advocate for your health like you will. And it stinks that you have to educate yourself so strongly, but it is what it is. Like, if you're not going to do it, I mean, nobody's going to care about you more than you. I mean, certainly your family, but again, you can't do things for others in that way.
And I think it's like you were saying earlier, no different than you got some clinics around you that do, free consults and blood work. Where I'm going with this and why I think it's important to mention on it earlier is like, hey guys, we go to the dentist, a couple times a year. Like, I think that you should look into what does your insurance cover, or finding a clinic is cash pay if it fits within your budget, right? And go once a quarter, right? Like, to see what is going on and what you need, to do to improve as we move forward with age, right? Because that is one
Right.
of my ultimate goals, especially just getting older myself, right? And I envision the future of me educating more people with experience as I get older, right? It's just a natural law of
Right.
attraction, okay? And maybe it's that I don't understand the 18 and 19-year-olds. That's why I want to do it. They really probably don't understand me, right? So I think that's something I would, encourage people, as you were mentioning, like, hey, see what is available, depend on the insurance that you have, depend on who is in your area, and plan that. I mean, would once a quarter be good? A little bit less? What would be the minimum that you would say, that you would encourage someone to go to a physical therapist?
I would say, again, it depends. Like, if you don't have any issues and you go through and you are just a really strong self advocate, you might not need it, right? If you educate yourself, there's so much good information out there. Now, you have to look for somebody that's educating you in the way that works for your life, right? Like, Will Grumpke, I'm going to just pick on him for just a sweet. He has amazing education. He has amazing education, but respectfully, like, I love his education, but when he gives certain advice, it doesn't apply to my life with three kids and a bit. Like, it just doesn't apply. But for the demographic that he reaches, he's amazing. I think the reason that you and I clicked so well is, like you said, we were kind of on the same path. Like, we've got three kids, we've got the business, that we've got similar educational backgrounds. Like, so I think that made you a comfortable coach early on for me and approachable for me. Um, I also really in the app, I appreciated Darcy's education, right? Just from a female perspective, she's such a good advocate. Um, but even more, and obviously I advocate for my profession, but more than that, you need to advocate for yourself at every turn. And I cannot say that strongly or frequently enough because I love what my clinic affords of me. And what I can say, there's just as amazing or more amazing clinicians in a busy clinic. But what a client or what a patient needs to feel comfortable doing is asking questions. I've never met a physical therapist that if their client said, well, what more can I do at home? What more can I do besides what we're already doing? That would not give them an answer. Right. But they're not going to, they're busy. They're seeing, 2 to 4 people an hour. Like they're not going to offer more if they don't think you need or want more. So that's the other thing is just ask. When you ask somebody for help, it goes back to that. Like, don't blindly just follow a plan without understanding it.
I like it. And that's what I try to do inside of, my education. We're not only here with the podcast, but inside our team calls is educate as much as possible. And, I love it when people ask questions, right? Now the devil's advocate, flip side, what devil's point of view, I don't know how to say that. The other side of it, like I expect people to watch the education, right? Don't just use us as the easy button, right? If we're providing you with education, we expect you to absorb that education, then ask the questions, right? And I think, when you were saying all that, it kind of makes me think of like the PT side of things for me, right? When I wrecked my mountain bike, had to have the shoulder surgery, right? You learn a lot of stuff because you ask questions. What do I need to do for this? How do I recover? And then on the flip side, when this distal bicep injury happened, right? I learned that, well, the proximal end doesn't need surgery, right? In a lot of cases is what, some people are saying because, as much as the distal end. So it's just, once again, you learn all this stuff. Now I hope and I pray that I don't have to use this knowledge now that I've learned to get through this arm again. But, once again, it kind of makes me think of that. Like, we learn when we are curious in those aspects.
Yep. I know. And I don't want to get too far away from just the mobility. I know that's why you brought me on. And I have a couple of just things I may want to make sure that are put out there. Like people think of stretching, right? Instead of mobility. And there's nothing wrong with that, right? But and stretching gets a weird reputation. People are either all in, like, and you'll have places like Stretch Zone that's all they do is stretch the muscles. And then you'll have people that are like, remember when for runners, it used to be said, don't stretch. It makes your running inefficient, which is actually true, right? You don't want to statically stretch right before a performance event, but that doesn't mean you don't stretch. It just means that you don't stretch at that time. But it's not a muscle system. It's a musculoskeletal system. You can't stretch a muscle without influencing the joint it's attached to. And there's so many other considerations if you even want to go into lymphatics and fascial planes. But when you think about it more as a system, you can appreciate that and we talked about this, I think, before the call, it's no longer just your bicep. That's how it started, but that's not what it is anymore, right? Your forearm is now compromised. Your shoulder is now compromised. Your shoulder is made up of 4 joints. It's not just your glenohumeral joint. And that in tune is going to affect your cervical and thoracic spine, your ribs. Like it affects everything. Having to wear that sling, having to wear that hinge brace, like it just starts to affect other systems. And if you don't at least appreciate that or work with someone who does, you're going to get 80% better. And that might be enough to live and not even worry about it. But then again, you have now that 20% loss buffer for future issues. And so when I say I want people to go head to toe, I mean it. Like I'm not going to obviously name names, but I literally worked with a runner on Monday and they came in with knee pain and it was the knee. And I was like, and I've gotten to my phrases. I'm like, you can all clinicians can steal this. I'm like, I know it's your knee. You know it's your knee, but we're going to look at everything and we're going to look at the knee last. So that way we know if you feel any better, maybe 30% of your pain isn't from your knee. It's from these other joints also being restricted. And that's exactly what I did with them. We looked at back, hip, knee, ankle, great toe, right? And I did it in that order. I assessed the knee, but we didn't treat the knee. And we treated mechanical deficits in those other joints. And their pain, Jeremy, was like 70% better. Like they still had a knee issue, right? But who wouldn't take away a huge percentage of pain without actually touching the affected area? right? Like you can't you can't negate that. Like people don't, I mean, not most of my clients don't come to me for performance. I do have a subset, but most of my clients come to me because of pain. So they don't care if they have a 30-degree loss of X joint. They care, does my knee hurt? But if you can show them, hey, even when your knee is at 8 out of 10 pain, if we do these four that have nothing to do with your knee, your pain will be better. And that might allow you to tolerate the actual treatment that will ultimately fix the problem that you're here for.
Yeah, and this is probably just a very vague example, right? I'm sure you see a little bit of it, or starting to see a lot of it. Like we are talking about earlier, like kids now, maybe young adults that have been in the cell phone era, right?
Oh,
So I think I just opened Pandora's box, right?
I have a
Um,
13-year-old.
yeah, so just fixing a posture issue could fix the pain in whatever area, right? So I'm just that's first coming to mind in that that standpoint, and I think that's really good knowledge for people to hear and know that yes, when they're like right now, okay, my pain, right, or my issue, we know is the bicep tendon, right? But the issues that I'm having now is, just like the other day when I ran an hour, but you got to think about it, all this was kind of locked in place, right? So I go ahead and lock my brace so that I, can't do my range of motion just because running, I don't want it to jam or whatever. But here I am, running like this, like a robot for an hour. And then, the pain, started coming in other areas. So those are things that even for me, the first place they massaged actively inside of my PT plan was my chest, and I was really surprised that my chest was so sore. Right? And they're like, well, what do you think is holding that helping hold that arm if your bicep not working? I'm like, oh, okay. So I think some
Well, and
strong.
don't forget your short head of your bicep and your pec minor have that same insertion point. So everything works together.
Together, yes. So it's like it, it is I think even for people who, for me, like strength and conditioning and exercise standpoint, like understand the muscles, understand the mechanisms, all that, but not to the degree when we look at when it's injury and injury prevention. So to save on time, because I do want to have you back on if you are willing to come back
No
on
worries. Absolutely.
certain topics and dive into it. Today is one of those like, hey, intro to everybody that listens and hit on some good stuff. What's probably a take home message or something you want to wrap up today's call for the listener?
I think if I just had to list it out, educate yourself. Number one. I mean, you have to find somebody, or even if that's yourself, you have to find a way to make it happen, right? Start head to toe. Do a system check, right? You get your car checked like every 8,000 miles, get yourself checked out. Movement lubricates our joints. You can't trip over a research article that doesn't say that movement is good for every part of your being. But if it's not a movement you enjoy, you're not going to do it. If it's a movement that is uncomfortable or painful, you're not going to do it. So it has to be something that you enjoy. It has to be something that is pain free. And I am going to throw in there my rules for exercise and fitness for my clients are universal. It has to be pain free. And pain free to me is 3 out of 10 or less. I've never finished a bench press ever in my life that wasn't 3 out of 10. But it has to be pain free. Like 6 out of 10 pain is not acceptable for unless you're doing some heavy performance work. And it has to be safe, right? If you have balance issues, it has to be safe. If you're lifting heavy weights, you have to do it in good form, right? So that is another thing along with just finding something you enjoy and that you'll actually do. I know that seems like ridiculously simple, but we tend to gravitate towards new and flashy and not foundational things. And I think that's another reason why, I mean, respectfully, I think I stuck with the app, not for any other reason than I just really enjoyed networking with you and some of the people that I met via the app because you don't approach because the app is more for, weight loss, which I mean, certainly I've utilized the macro tracking, but I think I've stayed with it more for the education and the networking. But you can't you can't do something if you don't measure it. And you can't look at weight loss if that's your goal as just weight loss. Like if you're not happy, it's not sustainable. If you're not sleeping, it's not sustainable. If you're not drinking water, it's not sustainable. If you're giving up happy moments in your life to lose an extra pound that week. Is it sustainable or worth it? Maybe it is in the short term,
Sure.
but you're in your own body for your whole life. So advocate for yourself, educate yourself, move your body, enjoy what you're doing with that body, be safe.
Well, I think it's a good segment for me to wrap up too. Is hey, the first app was developed as a challenge app in the beginning, right? And then over the years we've had progressed it, trying to change it to more of a lifestyle app. What I've done is added some team calls to that, Facebook community where we try to look at it as, hey, and I mentioned this earlier, is how your and I relationship developed. We are an online community, right? And for both of us, like we do a couple of challenges a year that we might be really in it, and the rest of the time we're just kind of keeping ourselves accountable. And that's what I loved about the process inside of that. So if you are a new listener, you can work with me on the First Form app. Download the First Form app. You add me as your advisor via the email jeremy@firstform.com. That's how you can get hooked up there. We do some cool stuff. And as Miranda said, I am not flashy. People, I got dad jokes. That's my entertainment. Is I do some dad jokes, but it's people ask all the time, like, well, Jeremy, what about fasting? And I like bring out the definition. Well, we all fast from the last calories at night until you eat the next day, which is called breakfast. That's your fasting period. So we do a lot of just definitions, a lot of simple things, but I feel like that's what produces results long term. So, and I appreciate you coming on here. We'll ask the listeners to send us over some ideas, but you can also maybe pick 2 or 3 topics that you want to talk about. I think that's a good way. We'll bring you on and make you a segment of, I like to call it Friends with Jeremy, aka I bring on smarter people in certain categories that I don't have the knowledge, and let you guys educate. So I look forward to doing more podcasts with you in the future.
Awesome. Thank you so much for having me.
Awesome. Thank you guys for listening, and we will talk to you soon.